Hello, everybody. My name is Bianca. I am the Community Care Coordinator at Right Love in Our Arms. You probably saw me last week. I think it was last week. We had another live. So this week we are back again with a couple more friends to talk about this year's suicide prevention campaign, You Are Not a Burden. First, just want to let everybody know that today's conversation may feel heavy at times. So if you need to take a step back, if you need to take a break, turn it off completely and check in with somebody, please do that. Please take care of yourself first. But as you all probably know, September is Suicide Prevention Month, and we're having conversations about suicide, what leads someone to a crisis, how to support them in those moments, and how we can all be part of preventing it. So we are going to bring on our lovely guests and introduce them. So hello, everybody. Please introduce yourself. We'll go Melinda, Kat, and then Erica.
Hi there, good afternoon. My name is Melinda Hockley, pronouns she, her, hers. I'm a licensed clinical social worker. I currently serve as the Senior Manager for Clinical Quality and Care Model at Eleanor Health. Eleanor Health's mission is to help anyone concerned with their mental health or affected by addiction in any way live amazing lives. Excited to be here with you all today.
Oh, I forgot. I think it's me. All right. I am Kat Harrison, she, her. I'm from The Mighty, which is an online digital community for people living with disability, chronic illness, mental illness, and rare disease. I myself have been disabled and chronically ill for 20 years. So bringing that to the conversation today. Thanks for having me.
Hey, y'all. My name is Erica Woodland. I use he, him, his pronouns, and I'm the founding director of the National Queer and Trans Therapists of Color Network. And we're a healing justice organization that is really committed to problematizing the way mainstream mental health thinks about our emotional and spiritual care and offering healing justice as a political and spiritual framework to transform trauma. Thank you.
Well, thank you all so much for being here and also for the very important work that you do. I think at Taloha, we see a lot of the impact of people helped by the things we do, and I'm sure it's the same for y'all. So just want to say thanks for being a part of that and for being part of this conversation. Also want to apologize in advance in case my Wi-Fi goes out and I get stuck on a really weird face. So hopefully that doesn't happen. But to get started with the conversation, as y'all know, this year's campaign statement is "You Are Not a Burden," which a lot of people have resonated with, including myself and a lot of people on the To Right Love team. We chose it partly because we know that feeling like a burden can be a huge factor in moving people from suicidal ideation to action. And we want to be part of disrupting that process so they don't get to the action or so that they don't get to believing that they're a burden in the first place. But that means that we have to talk about what gets people to feeling like burdens. So, in y'all's observations and experience, personal and professional, what realities or experiences contribute to people feeling that way? And we'll start with Melinda.
Yeah, so answering that can be really complex, thinking about personal and professional experience. Personal experience, when you think about reactions in real time, the pause, the breath, the body language can be very can inform your perception or experience in the moment and can be almost louder than words at times. So really being in a space that not only there's safe language and trust, but also that body language is really welcoming and communicates love and compassion as well. I think when I think about things that can contribute to feeling like a burden, microaggressions come to mind and how experiencing those can both acutely and longitudinally can cause harm, of course, but also contribute to that narrative. And thinking about having a disability or a dependence or a mental health condition or whatever it may be that requires you to seek support, that just seeking support, as we all do in everyday life, that kind of vulnerable display of seeking support that's larger than asking for support on building IKEA furniture. That's very different than asking for support in navigating finding a healthcare provider that meets your needs. So just thinking about the vulnerability of asking for support for those larger items.
Kat, Erica, do you have any thoughts?
I think that the disability thing obviously resonates with me, Melinda. I think just on a personal level, as I said, I've been disabled for 20 years. My very reality is that I have to be dependent on other people. I feel really lucky that I'm even physically able to work full time. If I didn't have a position at the Mighty where I could work from home, I likely wouldn't be able to work at all. And I think that concept of needing someone else to survive, just on a very practical level, inherently feels burdensome. And I think that, I mean, this campaign resonates with me deeply because I struggle with feelings of being a burden on other people. I'm not even in my house today because I needed assistance, so I had the energy to do this, right? Just the very naturalness of it. But I also think one thing I want to make sure and that we talk about is there are two types, I think, of feeling a burden. It's the feeling a burden on ourselves, the things that weigh us down, but then there's the feeling of being a burden on someone else, and whether that's the reality or not, and really what does it mean to be a burden. So there's lots at play here, but that's at least how I experience it.
Yes, thank you. So much of that resonates with how I see this issue. And I think, we really need to reframe how we're thinking about suicidality and suicide prevention. Feeling suicidal is a symptom of a larger problem. And it's actually an understandable response to the unnecessary suffering that we're experiencing now and that a lot of our communities have experienced across generations. So when we think about the legacies of violence, whether it's colonialism, genocide, historical trauma, generational trauma, and structural violence, like we have systems that are literally set up to annihilate communities that are experiencing oppression. And so that heaviness often gets internalized. And so a lot of what I think about is the burden actually belongs on the root cause, right? And sometimes we are trying to address structural issues through individual care. And I think that's something that we think a lot about in the network is how do we problematize that? How do we give folks access to care, but also think about what it looks like to integrate the political conditions and to do almost political education inside of therapy or treatment, right? To help people understand their experience and context. We know that the more intersections that you sit at, the more you are at risk, right? For state, community, familial, and interpersonal violence. And, when you're living with mental illness or a mental health condition, that also puts you at further risk of harm by the state, whether it's police or forced treatment. So, there's so many reasons that we need to talk about this, but oftentimes we just stay focused on the individual. And some of what I'm really excited to explore is like, how do we transform the conditions, right? Because we know that if we address the root issues, I would love to be in a world where we don't have to have a suicide prevention month. And also, why is it just a month? But that's a whole other story.
Yeah. So one thing that I think has been very different about this campaign, the phrase feels different from previous campaigns because they're usually phrases that Tualaha comes up with that are related specifically to suicide prevention. And this one we say all the time to everybody, regardless of what they're going through. So I think it speaks a lot to how suicide can affect every parts of our lives and vice versa, how everything in our lives can affect the journey that we may have that may at one point include suicidal ideation or an attempt or whatever that looks like in somebody's life. But I actually wanted to, the question I have here is how realities look different for people depending on their identities, which Erica already beautifully went into. So I was hoping that we could dive into that a little deeper and talk about what, say, specific identities, for example, how they are affected. And I know as a queer person of color myself, those intersections can be beautiful and colorful and vibrant, but they can also be extremely heavy, especially when you have to bear the burden on educating people around you. So can you talk about like what those intersections look like and how the people in those intersections might find themselves in a path that's leading towards suicide?
Yeah, I can speak to that from the perspective of thinking about substance use disorder in individuals with who struggle with use or misuse of substances and alcohol. There is a significant overlap with suicidal ideation, mental health needs with individuals in recovery and pre-contemplation of, is this something that is impacting my life negatively or positively, and exploring that. I think when we think about that, oftentimes when you are seeking out or beginning that contemplation of seeking out support for substance use, you're often met with reactions or statements that are rooted in it being a moral failing, or it is a choice, or something along the lines that puts that burden or perceived burden back onto you as you are making this choice to do this, when in actuality it is a disease that needs to be treated like diabetes, and that we're not going to, as a provider, you're not going to stop treating someone with diabetes because they have a candy bar and they come in and their levels are off. You're not going to, as a substance use disorder provider, should not turn away, judge, or punish someone for use or continued use, or choosing that abstinence is not the path for them, which is absolutely acceptable. And encouraged for a lot of treatment journeys that it's best for them. We shouldn't be firing anyone or turning anyone away for displaying the need that we're supporting them with. I think too, looking at recovery not being linear and approaching treatment from a biopsychosocial perspective, you have to think about everything that recovery impacts and everything that substance use and misuse mental health impacts, not just your physical health, not just your mental health, but your spiritual health. Cultural recovery is a really interesting term, thinking about finding support and redefining what your culture looks like. It's very complex when you think about the overlap with the substance use disorder space.
I think for me, and something I think about a lot in terms of specifically being disabled, is the idea of like living in a world that wasn't created for you. Right. So I'm constantly going through life being faced with situations and people who just cannot, one, may not try and understand, which is a whole nother issue, but then also just like not knowing, right? You don't know what you don't live. And I think that that's part of the natural part of human experience. But I think especially with like the intersection of suicidality, and when we think about physical illness in particular, I think that part of the root of that I see is the idea that people who are disabled, they choose it. I choose to be disabled. I choose to be chronically ill. And I think that that is what feeds into the narrative of just do better, you're lazy. And I think that all of that very, very much leads to suicidal ideation, suicidal thoughts. So Erica, what you said about like addressing the root cause, it's literally what it all comes down to, because it is impossible to survive or thrive in systems that are not set up to support the people that need them.
I think to even expand on that further, when we're thinking about use or misuse, it's not that the taking a substance or the impact, the immediate acute impact that you get from that action. It is, you're seeking connection, you're seeking relationship, you're seeking being social, you're seeking relief from pain. Those are all the root causes and have a much more a broader impact. And really looking at the need behind the behavior is so important, because unless you address that and you look fully into a whole person, there's not going to be sustained support and healing.
Erica, do you have any other thoughts on the question? I know you already went into it a bunch, but I imagine that you probably have a lot to say about this.
Yeah, this conversation feels really tricky because I think I just keep thinking about those of us who are considered most disposable, right? And even as a Black trans masculine queer person, all the things, it's like even inside of my broader community of QT BIPOC folks, that, you know, I'm not experiencing the most marginalization, even inside of this community that experiences a lot of marginalization. So there is this piece, you know, to Kat's point around, if you haven't lived something, you don't know something. But I do have the experience that people who don't have a lot of access to privilege, it's like, it's not that big of a leap to be able to understand, like, oh, people hate on me and try to exterminate me. So let me try to not do that to other people, right? And that's not to say that we don't have those issues in our community, but I think it's really important to always center the folks who are most impacted. And in order to do that, we have to really interrogate our own positionality, right? And interrogate how that positionality impacts our suffering and impacts our access to care. I think a lot about how, in my own experiences as a young person with depression and suicidal ideation, you know, part of my healing journey was really about like expanding my political consciousness. Because once I realized, I was like, oh, I hate myself because white supremacy, right? I hate myself because I was assigned female at birth. I'm queer, right? I grew up poor, like that this was by design, right? This was not an accident. And so if we are, again, understanding the broader context, like this system is working very well, right? It benefits those in power for us to even be having this conversation, because at the end of the day, you know, when we're talking about racial capitalism, like if you are not able to produce for the state, right, or you have your labor exploited, then you don't have any value, right, and then you do become a burden. So it's so tied to like that intersection of capitalism, ableism, and white supremacy, and I think we really need to figure out how, like in treatment communities, to have these conversations in a more nuanced way. You know, because our work at the network really sits at the intersection of movement building and the field of mental health, we know that part of our role is to be that bridge. But some of the conversations that are happening in the mainstream mental health space are really just stale and not relevant to a lot of us, because we're kind of talking around the thing, and we're not naming things clearly. And I think it's because it's hard, right? You know, it's much easier for me, you know, in my therapist role to be like, okay, well, I'm helping somebody cope with shitty conditions and therefore I did my job and good night, versus like, whoa, this problem is large and it's been across generations, right? And so how do we politicize folks who are doing this work? Because this work is political, whether you think so or not, right? Our suffering is political, therefore our healing is political. And I think that the number of folks in the communities that I'm a part of and care most deeply about, we've been cut off from our cultural traditions. So also we're getting go to therapy, like that's the only model. And I'm a therapist, yes, go to therapy. And also, can we have all the other ways of healing? Can we have access to our cultural practices and traditions that have been criminalized, right? So again, I often really like to be with and alongside folks who are choosing to confront their suffering and choosing to have a witness, right? And sometimes that can be the thing that keeps someone from moving from ideation to action. But we don't have enough resource in a lot of our communities to be able to meet the needs.
I mean, first of all, snaps to like every single thing. My hand probably would have fallen off, so I couldn't do it as you were speaking. But yes, absolutely. And I think it's really important to emphasize what you said about how it all being rooted in like capitalism and white supremacy, because I think people don't realize how deeply those things are entrenched and how the core beliefs of those institutions dictate everything that we do. And I know that a lot of people will probably be like, well, how is, like, if somebody says something to you, or like somebody's just trying to help you or whatever, how is that rooted in white supremacy? But when you really examine it, it's a lot of like the white guilt and the savior complex, and like things that are oppressive even in their attempt to be helpful. So I think it's, like you said, it's incredibly important that we think about the root cause, which the root cause is more than just like oppression. It goes way back to like what are the beliefs that oppression comes from, which again, like you said, it's an incredibly difficult and nuanced topic, but it's not going to happen if we don't have these conversations. So I'm glad that we're all here talking about it. So another thing that we've talked about a lot is that the systems we have in place are not really serving people. And like y'all have said, we need to think less about like us being the burden and what kind of burdens those systems are placing on us. So can y'all talk about some specific things that you think need to change in terms of how the world works so that we can help keep people from getting to the point of feeling like a burden, and how we can get involved in making those changes come true?
I'll speak specifically to the healthcare system, since that's really what my experience is rooted in. So as a patient in general, I call myself a professional patient as a joke, but it's actually very much my reality. I currently am in charge of coordinating my care. I, as the patient, have to put all the pieces together. I don't have, really a doctor that's kind of leading me through it. I don't have a care coordinator who's leading me through it. So me, in my physical struggle, on top of everything, I'm also coordinating my care. And I say that to say that's not how it should work. We should be able to have someone guiding us through, that the person going through it has someone walking, rolling, strolling aside them. So to me, that's part of it, because what makes me feel like a burden is that I'm not getting care fast enough. I don't know if I'm getting the correct kind of care. I can't necessarily pay for the care that I need. And so I think that to me is like a big part of where it starts. I also think I think what you said, Erica, about treating things as a one size fits all with therapy, for example, I think the same thing goes for health as well. Our system is set up for one lane. And if someone doesn't fit in that lane for treatment, I'm even getting this right now with some health problems. It's like, well, I don't know what to do next for you. And what happens when someone tells you, I don't know what to do next? You're meant to feel like a burden. You start to question your existence. You start to question, well, if I'm not made for that lane, then there's no place for me here. And so I think we need to widen the treatments that we have available. We need more advocates in the space. We need people who are, willing to go into a healthcare field, but in other tangential lanes, right? Being able to be, I also don't want to put the burden on people like having to like enroll in the healthcare system, but I think that part of it is that the roles that we need don't actually exist in terms of what we need people for in that lane. So that would be my answer.
I can jump in. I do think that when I think about creating space, and when we talk about the burden of needing something or seeking something, it often requires time or energy or connection or something that seems additional. I think it is important to take a step to creating space for that before it's essential or before it's needed. And we have to remove other things or make exceptions to create that space or time or connection. Relationship creates all opportunities. So working on that from the beginning as a provider, as an individual in your life, creating those creating intentional room for support and love before it's needed, so that it's not an additional step to have to create it when it's needed. I think when we think about healthcare, and what that means is that we're intentionally thinking about a space, a workflow, a situation, a care model that is thinking about who can access these services, what they're going to need before they come into the space, so that it doesn't require the person that needs that service to have to raise their hand and say, I need this. It should already be there. We should be thinking about it. We should use the privilege that we have to resources, to education, to partnership in the community to be able to do that proactively.
Oh, I love this question and I hate this question because I never have good answers. I'm like, I am not McDonald's. You're not going to get it fast. No easy, no easy over here. So many more people don't have access to basic human needs, right? It's almost like, I came up in harm reduction and HIV prevention, and it was like housing first, housing is HIV prevention. Like literally, if we focused exclusively on getting people basic needs met, like this would be a very different conversation, right? And so I think a lot about what that hustle is like day to day to figure out where am I going to sleep, when am I going to eat, do I have access to like a safe place to be? Those stressors plus all the other things that we're talking about really, really contribute to this experience of feeling like a burden. I think the other thing that needs to change is like, a basic human need is access to safety and belonging, right? And so if you're in a world where in surround sound, the messages are, you should not be here for one or many reasons, there's a lot that I think individual people can do about that. I think there's a lot we can do about that collectively. And I feel really excited because there are a lot of groups that I'm aware of that are kind of building out more revolutionary models of care that are rooted in some of the values that we're lifting up. I also think there's a need to put this moment in historical context. So, even talking about this healthcare system, if you look at the roots of this healthcare system, it's horrifying. The roots of this healthcare system are genocide, enslavement, stolen land. Like that's literally, so are we going to tweak this thing or are we going to come up with something else, right? In the meantime, while we have to live in this system, how do we actually bring together the growing movement of practitioners who are like, we're not going to participate in like the harms of the medical industrial complex. We're just not going to do it, right? And some of that is about people engaging in like underground strategies that we don't need to talk about on StreamYard. And some of that is about folks who are really in positions where they have more influence to do structural and systemic change, right? I think a lot about, my own experiences engaging with the medical industrial complex and being like, I'm a whole social worker who's done a lot of case management, and I'm also my own care coordinator, and this is stressful, and I don't want to go see these doctors, right? But when I get there, the way that I'm treated, all of those things matter, because when you are engaging with that system, it's really hard to be empowered in a system where you don't get to determine what your care looks like. You don't get believed about what's happening in your own body. You don't get believed about what you think is going to help. So I think there's a lot about how we transform power dynamics in the relationship between folks who are seeking care and folks who are supposed to be providing that care. And how are we organized? How are we participating in the major movements of our time around economic justice and climate justice and racial justice and disability justice, gender justice? I mean, we need total revolution, right? Because and that's not going to happen overnight, but I'm saying that because at the end of the day, I am tired of seeing our people not make it. Like I'm tired of it. I've been tired of it since I was in my early 20s, and that was 20 years ago. So if we're not, again, at least understanding what the root problems are, then we're going to keep having interventions that are really not even reforms. We're going to have interventions that make us feel like we're doing something and we're not actually moving to substantive change. And I think we're in a moment where there's a lot that's possible because we're in so much crisis. And so I think about people, in particular, those who don't have access to care, how folks are organizing that care for themselves, and where can we invest and support those ecosystems of care that our peoples have always had because we've required them to survive.
I feel like I just want to comment on everything that you say, Erica, and just like lift it up and to expand on being an expert in your own lived life experience, something that we really value and something that I personally just find so empowering myself is the thought that despite our education, experience, team training, we are an expert, yes, in our field, and we've dedicated to supporting in this way, but also the person that we're interacting with is just as equally an expert in their experience, and that is as valuable, if not more valuable, than what you're bringing to the table as a provider. And how can we meet in the middle to share, to see where that overlaps to reach solutions? And even that concept that somebody is coming into a room with lived life experience that needs to be looked at as the same level of expertise is not common. That's not something that we see everywhere that we go. And it has to be, because we have bias and stigma and assumptions that we automatically are going to make about things that we don't know anything about.
I've seen people comment about stigma in particular, and I do think that that's a large part of it. Something that we say on the Mighty a lot is like, no one knows your body but you. And that is not always listened to, right? I'll give a really quick example. When I was 15 and kind of everything was happening in my life before I became disabled, I lost my vestibular system, which means that I don't have a balance system anymore. Everything bounces. And so when that was first happening to me, I had to relearn how to read and walk and write. And I was being told, this is the best therapy for you. This is what's going to make it so you can survive. And I'm sitting here going, but it's not enough. Like, I am not able to function like this. And so what did I do? Kind of made my own therapy. And I had to figure it out along the way, but I wasn't trusted. No one was trusting me when I said that this is not working. And I think that in a lot of spheres, no matter what sphere it is it's that. Listen to the people who say it's not working. What would make it work? We're not asking that question, I think, to the people who are living it enough.
I also think a lot about like, how do we demystify these systems, right? It's like when people are like looking for a therapist for the first time, I'm like, oh, you better interview people. Like, I have like 10 questions. Like, have you thought about this? Have you thought about that? Because like people need to be a good fit for you, and you need to know that they have the skills to meet your need. And there are things you can already know off the bat that aren't going to work for you because you're a humaning in the world, right? I think specifically talking about like medical providers, just like the environment that you have to be in, it's really hard to advocate for yourself when there's all of these layers of power. And then often you're in vulnerable positions with practitioners, right? So talking to people and role playing with people like, okay, if this happens, what are you going to say? What are you going to do? How do you prepare before an appointment? How do you regulate yourself during an appointment? What's the aftercare plan? Like, these are the kinds of things that I don't like that I have to do this, but I'm spending a lot more time doing that because I feel like since the pandemic, the crisis in healthcare has meant that the quality of care the folks that I'm in community with are getting is just like so much worse than it already was. And I think being able to really clearly explain to people, like, you have power in this situation. You have the power to walk out, you have the power to like reward people. Like, you might not always have the energy to do that, but like, how are we creating more choice? And I think there's this piece too around like, yeah, people are experts on their lived experience, but if you've lived with a chronic illness or disease your whole life, you actually do know more than these doctors, period. It's experiential, right? And so that's not to negate practitioners' knowledge and skill set, right? But it's like at the end of the day, I think as patients and clients, we're bringing a lot more than just our lived experience, because we've had to become experts because these systems are not set up to keep us alive. They're just not.
Yes, to all of that, just yes. We actually have a question from the comments that's related to what Erica was just talking about. And the question is, what should you ask a therapist to find out if they're a right fit? So, y'all, in your professional and also personal experiences, what would you suggest?
I think Erica already mentioned a few great questions to ask a therapist. I think when you're going into a new interaction or relationship with a therapist or any provider, it's important for you to think about what are you wanting to learn from them? Do they have experience in that? What are you hoping to advance that you already know? So if you know that EMDR is successful for you and you want to do that, what's their experience with that? If you have a particular consideration, need, or something that you want to bring into the conversation, gauge their comfort level on talking about that. Say that this is something that you value, that you hold as an important piece of your journey or your recovery, and ensure that you're transparent. And again, that is you carrying the weight of that into the session, but it's also advocacy and making sure that you're identifying someone that's going to be able to advance your needs and your understanding, and not be asking you questions about something that you need them to be an expert on, or at least educated about, in a way that's going to allow you to step into healing and not be comforting, educating, or being a support to your therapist.
I think availability is also really important. Sometimes people need more than one weekly session, right? And some therapists are able to provide text messaging or emailing or giving you an emergency line to reach another therapist, and some don't. So I think if you're able to check in with yourself about what you need, right? If you need more support than 1 to 2 sessions a week or 2 sessions a month, then you ask that. I think the other thing, and one thing I've spoken with, especially people who live with BPD, is the idea of, like, does your therapist give you homework? Some people really benefit from those exercises, something they can apply during the week. But do you like that? And so I think it's important to ask your therapist that, and it's totally okay to do that. I think the third thing I would say is that not every therapist is going to be right for you, and it's okay to feel like it's not the right fit. I do the exact same thing with physical body doctors. Sometimes I just know that their way of going about things isn't for me, and I think you need to remind yourself that you do hopefully hold most of that power. Obviously, insurance, stigma, cultural stuff all plays into that. But I think that those are all things to think about.
I love this question. I often tell people that the consultation is really important because how it starts is how it's going to be. So I think, especially when you're starting with a new practitioner, there should be a lot of feedback. It should be very frequent. It should be integrated into the work because, you might have a consultation with someone, you might not figure out if they're a fit or not for 3 months, right? I mean, it's a relationship and it takes time. I think some of the questions that I typically ask are about, what modalities, like if I want EMDR, I need to make sure this person's been trained. How long have you been trained? Because I'm a therapist, I need a therapist who knows how to work with therapists because we have all the language and then we're out here not healing, right? Because we have the words. I think it's important to ask if people have experience working with the issues that you have, working with the communities that you're a part of. And I think there's also this piece around cost, right? Usually, I think it's important for therapists to be more transparent about cost, because sometimes you'll go through a consultation with someone and you'll be like, I cannot afford that, and you don't accept my insurance, right? So being really not being shy, being very clear about what you want and what you need, and also style, right? So I know for me right now, I have a very big and robust care team. And so I needed my therapist to fit inside of a larger care system that I've built out. And I was really clear about that, right? And I'm clear about that with my other practitioners so that sometimes people they just assume that you're new, or they assume that you haven't had experience, right? And so to Melinda's point, like, how is this going to add on to what I've already been doing? So don't be shy, and really, like, I would say hype yourself up around the amazing work that you're doing on yourself, so that it can be more of a partnership, and it's not like, oh, this person's going to fix me, or this person's going to heal me, or they even have some magic wand. It's like, in particular in therapy, it's like, I think we're really in it with people, and it's like, how are we calling people back into their own inner healership, right? Like, I don't actually have any magic. Like, I have all kinds of training, but at the end of the day, like, that, none of that shit might work for you, right? So just getting really clear. Does gender matter? Does race matter? Does age matter, right? Does disability matter? Like, get super clear, and know that you're always going to change your mind, right? There's been so many times I had a practitioner who had the same identity as me, and I'm like, oh, no, never mind. I learned a new thing, right? And don't be afraid to fire your therapist. I know that's probably not a good thing to say, but I mean, I love when people give me feedback. I think it's really, really important. If I've created a container where people can tell me, hey, that didn't land right. Hey, last session, I didn't like the way you said that. That makes me feel like I'm doing my job, right? And so how are we as practitioners intervening around that power differential? And then how are folks who are going and getting therapy empowered to be like, no, like, this needs to work for me, period. Especially if you're paying out of pocket or paying a copay. Like, you're the customer,
Absolutely. I think some things that I have also learned over time are, one, it can be exhausting to have to introduce yourself to a new therapist every year, every other year. It takes sometimes months, depending on the therapist and what kind of space you're in, to get to a point where every session isn't just like, this is what I'm struggling with and this is my whole life experience. So if you're looking for a therapist long term, then you might want to ask, like, what's your status? Are you an intern? Are you like a full licensed therapist and you're going to be here for a while and I don't have to worry about you like getting moved or something? I know that some people, like, if you get therapy or counseling services from your university, that may be a little more out of your control. But if you are in a place where you're able to go to a private practice or whatever it may be, and that's something that you're interested in, then definitely ask about that, because once I realized and I was able to do that, it has made a huge difference. And I've been with my therapist for like 2 or 3 years now, who I actually found on Erica's network. So shout out to that. And another thing I would say is, like we had mentioned earlier, we were talking about specialties and maybe do you have experience with families, adults, whatever it may be. But a lot of therapists also offer like running therapy or music therapy. And that can be really, really healing for people who process and learn in specific ways. And I know for me, something that has been a big part of my healing journey is art, and being able to process and express things through some sort of visual means has been really exciting for me. So my therapist has found a couple platforms that we can use online, and we can both look at them from whatever video call we're on and kind of work through things on a visual standpoint. So don't be afraid to ask about those things. And it may not be as accessible to everybody, especially if finances are a limiting factor for you, but it is definitely something worth looking into if you feel like traditional therapy or therapy that you've had before hasn't worked for you. We also have another question from the comments. Thank you all for being so involved in this conversation. In regards to healthcare, what do you think are the main barriers to participating in clinical trials? I know that Kat had an answer on that.
There are so many. I think that one thing that we need to keep in mind about clinical trials is that they're very specific. So you need to usually be a certain age. You need to live with a specific diagnosis, but you also maybe need to have had the diagnosis for a long or a short period of time. Sometimes you need to have had other types of treatments before you try this clinical trial. Sometimes where you live really makes a difference, right? So for instance, if we have, a US-based clinical trial, but you live right across the border in Canada, you're automatically not able to do it because of location. There also may not be clinical trials in your disease. I currently go through that. I have something called sunk syndrome, and it's a very rare headache condition. There's nothing for me. There's nothing going on in the healthcare space, nothing that I can join in on. I think it's important to remember that. And I think that's kind of where advocacy has to come on the front end, the fact that we do need clinical trials for certain diseases. And sometimes cost is, a lot of times clinical trials, you're either paid for it or compensated in some other way. But typically, if you need to be somewhere for a clinical trial and relocate, that can definitely make a huge difference as well. And then in terms of other types of care you need while doing the clinical trial, that may not be covered by health insurance. So there are many things that can be barriers.
Melinda, Erica, do you have any insight on what those barriers can be?
I can speak to one personal experience of the kind of emotional barriers that you may process through. I had a specialized surgery that I didn't really know that much about until it was happening. And after the surgery, I had an amazing surgeon who was really patient-centered, whole person health, called to check on me during recovery, an amazing person. But she asked if they could use my case in my journey as an educational materials. And that was not something I anticipated navigating as I was recovering. And the kind of emotional processing of that, feeling, what is the norm, and I'm abnormal. So is this going to be, on display for everyone to see? What kind of information is going to be shared that could lead back to me? And processing through why I was so concerned about that identification piece versus this could help someone else that, like me, didn't know what I needed or what I was experiencing. I did think that everyone else experienced it that way, and they don't. So if this could be, it could help someone else, help a practitioner learn how to speak to someone and not dismiss a symptom or experience, then that is something that I want to do. And that processing needed support from a therapist, needed support from family and friends to navigate that. Not necessarily a clinical trial, but kind of an extension of what that looks like to go beyond care and have your experience shared with others.
Yeah, thank you for sharing that. So one more question that we have, and then we will wrap up. But we have talked a lot about long-term solutions and things that need to change on an institutional level and ways that we can kind of dismantle these systems. But in the short term, there's people who are struggling and may not be able to see those things come true. So in the meantime, in terms of thinking about it on a time frame that may feel a little more feasible to some people, how can we help them feel like less of a burden? Are there things that y'all have experienced or seen in your professions that have really resonated with people and helped them release that idea of that they're the burdens as opposed to the things around them? And yeah, whoever will start with Melinda. Sure.
Awesome. So one thing that we have that is very important to us and something that I have really enjoyed learning more about and researching and partnering with my peers is learning about language and how important language is and things that we've learned over time. Where do the origin of that term or word or phrase, where does it come from? Things that we use and have learned are harmful to others that don't have our same lived life experience. We have welcome and unwelcome words at Eleanor. So we use person first language. So we're not using terms like alcoholic or something that is defining someone by their condition. It's a person who's experiencing alcohol use or misuse or needs support with alcohol use or misuse. And thinking about someone experiencing homelessness. They're not a homeless person. They are someone that's experiencing something. And we're really mindful of language. I think that's a first step in something that we can think about. Language can immediately be a barrier to relationship. It can immediately lead to harm. So being mindful of your language is essential, and also partnering with one another to support each other in evolving your language and calling out and saying, I experienced that in this way, in a place of I don't want harm to be experienced by others. I'm going to share this with you in hopes that you can hear me, and let's brainstorm different alternatives or can provide resources so that that language will change.
There are two things I do. So if you find it helpful to kind of reframe thoughts, I do that a lot because that's something within my control. I also think asking yourself a lot of questions. So something that I do if I feel like I'm a burden on other people, I ask myself, has that person told me that? Has that person done body language? Has that person done action? Or am I perhaps perceiving it? And sometimes I know that mental dialogue and what you're telling yourself may never match up to actually what's happening in reality. But sometimes when I step back, I realize no one said anything to me. It's me feeling this way, and it usually grounds me a bit. And the second thing I do is because I'm not able to do a lot of things that other people can do. So small things that I do is if I can't, for instance, meet someone in public, right? And that's a way that other people show up for each other. What's something else that I can do? Can I send a funny text? Can I write a letter? Can I buy them a cup of coffee? I don't know. Like what's something that I can do that usually also helps to minimize my feelings of burden as well. So there are two techniques, pretty simple, but I employ them often.
I love those. Thank you. Yeah, I think this piece around being a burden, it's for me really feeling deeply connected and tied to shame. And so I think a lot about the things that have helped me transform shame, a lot of times being in community with people who have shared experience, people who don't even have to use words to say you're not a burden. It's just like I'm in your presence and I just know that I'm not a burden, right? And like I'm very somatic, so I think about how I feel in my body when I'm in certain environments. And being able to be in community spaces where you can talk about your experience and know that you're not alone, right? And if we're all feeling like burdens, then ding, 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 maybe we're not burdens, right? But I do think that this is real relational work, to a lot of what Melinda and Kat have really named. And there's a lot of internal work and a lot of internal exploration. So I don't, if journaling is your thing, I love a good workbook. I feel like we have more access to things if you have access to internet, which not everybody does. But there are a lot of kind of reflective activities that I think could be super helpful to externalize, and I think a practice that I do probably every day is go somewhere in the natural world or connect with the natural world, whether it's outside or on my computer, because we are nature. like when I'm looking at a mountain and I'm like, this is so majestic, I'm like, oh, that's a reflection of me, right? So I try to find other places where I feel awe and where I feel inspired. And then I tell myself like, oh, right, that's you too, buddy. Like you don't get to, you're not separate, right, from the beauty that is in our world. So those again are like a few things, but I think that doing it in community is so important.
I think I'm gonna get "You are not separate from the beauty in our world" tattooed on like my face or something. That's just a really beautiful thought that I like. So last question is, I just wanted to create space for y'all to hype up the work you're doing and the amazing spaces that you're creating. So I can start by talking about Taloha and letting everybody know that if you want to be part of the campaign, you can go to youarenotaburden.com. You can buy a pack, you can fundraise, you can donate, you can share on social media and see all of the ways to be involved in that. And if you find yourself in need of resources, you can go to taloha.com/find-help. You could just go to the website and it'll be right there in the corner. But if you need resources, you can use our Find Help tool to find affordable resources in any zip code in the US. And we also have an international list of resources. So please know that help exists, it's real, and it's accessible to you, and you deserve to be able to find it. This is y'all's time. Now, if you want to say something, you want to talk about how you are helping people, some of your favorite projects, please let the world know all of the good that you are doing.
It's hard to hype yourself up when you feel like a burden, which is just gonna say that, but no, I will say that
that's exactly why I did it.
I knew it. So you can find us on themighty.com. We have an app. I'm also just really proud to say that some research just came out from Harvard and the Mighty that showed that reading one story a day about someone's experiences about suicidal ideation on the Mighty helps curb someone's desire to die. So I'm really, really proud of that work. And I think that something I hadn't said was exactly that. Especially when it comes to suicide, is talking to other people about it. It's a very scary word, but not only telling someone about what you're experiencing, but also listening to stories that may be similar to yours can actually be very healing. So I just wanted to say that is where you can find us.
Yeah, so our website is www.nqttcn.com. We have a mental health directory that has queer and trans BIPOC therapists. And we also have a mental health fund that we open up every year to help people pay for therapy, to this point of it's not affordable, and a lot of therapists are not a lot of the good therapists are not on insurance panels. So you can find more info about those resources there. And we also have a resources page. But one of the things we're really excited about is there's a growing ecosystem of BIPOC-led mental health organizations and other therapy funds. Like, people are sending me things all the time. So part of our commitment is to also curate those resources, because if we don't have it, we want to make sure people can find what they need.
So Eleanor Health, you can visit our website, eleanorhealth.com. If you or your loved one are struggling or impacted by addiction in any way and need support, we are here to support you. There's no, you don't have to be ready to navigate substance use or misuse. You may just want to navigate what does anxiety look like, and not be ready to tackle substances. That's not a requirement to be in our program. We don't fire any of our members for use or misuse of substances. We take a whole person health approach. So we have nurses and therapists and psychiatrists, and most importantly, we have community recovery partners and health advocates who have lived life experience, who are here to support you through that journey. We really value live life experience. It's not only in those direct member facing roles, but also in other roles and departments within our team. We have individuals with live life experience. We are our members, and we want to be serving our family and our loved ones. And we bring that into work. We are able to create a space where we are able to support one another authentically and organically, and that does translate into the care that we provide for our members. So really excited about the work that we're doing. Really excited about the creative and sustainable solutions that we're looking to create through the development of our care model that's rooted in equity and harm reduction.
Well, thank you all again so much for being a part of this conversation. Everything that y'all shared, your experiences, your knowledge, your expertise is all so valuable. And just looking at the comments, it seems like a lot of people definitely benefited from this conversation as well. So Harry just said we did a great job. Thanks, Harry. We appreciate you. So Yeah, thank you all again so much. We are so grateful to have friends in the mental health world that are doing work that we know is incredibly needed. And like we've all said, doing it in community is the best way to get it done. So thank you all for being a part of our community. Thank you to everybody watching and everybody not watching for being part of our community as well. And yeah, just know that you are not a burden. Thanks.